Good morning, everyone. Let's call to order the HR committee. We do not have any citizens wishing to address the committee. So our first item on the agenda is the approval of the minutes. Can I get a motion to approve the minutes?
So moved.
No, that's scary.
Oh, my.
Wait a minute, now that's what we're looking at?
All right. Oh, I had to go get my makeup artist.
Oh, no.
That would keep me fine.
All right, it's been moved in second, with there being no corrections, all those approve the minutes by saying aye. I will like to welcome our new member to our HR committee, is Dr. Nick Zenarosa. Remember we approved the bylaws to change, and they would have a medical staff representative. So welcome to the committee. We're going to be swift today because it's packed. So I will go to our next item. Nikki, and you have, Nikki, I will tell you that the information that we received was a little late getting to us. It's a lot of information, so that's caused us to stay up overnight to read it. And that's not something that you normally do, but I did want to mention that it's helpful for us to get the information a little bit earlier.
Yes.
Okay. All right, so you're up now.
All righty. I would like to introduce Pia Walker. Pia is currently a member of the HR team and is serving, has been serving as our executive director of HR. And Robert will talk to you a little bit about Pia in a little bit. But I wanted you to know that Pia was very instrumental in helping us move our employee engagement. And she is a valuable member of the team. And so we're going to go through and talk about our employee engagement survey results. We have worked very closely over the last 4 years with Press Ganey to achieve some great results, and we're proud to talk to you about our results today. If you turn to slide 2, Press Ganey has a model that looks at the organizational domain and the manager domain as it relates to employee engagement, as well as an employee domain. And there are questions within that that come up to make us a high-performing organization. And we're going to get those slides up so that those in the audience can see those. There is the organizational domain. There are a bank of questions in that domain. Again, manager domain and employee domain. When you have great scoring in that area, what you will see is better engagement, and which leads to a high-performing organization. And so we are pleased to be able to say that we are just that. Our results are very high. We had great improvement, and I'm just foreshadowing what I'm going to tell you, but it is leading to some really great performance at JPS. We will receive a tier score from that, and then of course we take the results from the survey and use it to actually action plan to receive better results. The benefits of employee engagement are that employees are willing to go above and beyond when they are engaged in their workplace. Certainly there have been some great cultural changes over the last 10 years since Mr. Early has been here, especially around the 3 rules. And those rules have really led to our transformation. And so employees are energetic and enthusiastic around our culture. They are loyal to the organization, and you can see other things that happen when you have an engaged workforce. Yes, sir.
What are the 3 rules?
The 3 rules are seek joy, own it, and don't be a jerk.
Okay.
Okay.
Just for the record, for
Yes,
Nick.
they are.
Nick knows them. They preach it down in the emergency room quite often.
I have a tattoo of those rules on my shoulder.
Don't worry anything about it.
All of our team members know it, and we live it every day.
Okay.
I wish a lot of others would follow those rules. And so,
Right.
yes, sir.
Before you go far, We talk about, or I hear you talk about, just about the engagement. How do y'all define engagement then?
Right. So I would define engagement as a group of team members and team members. They can be the frontline team members, it's management, it's our physicians, it's all of us working together to achieve the best for the organization. In this particular instance, it would be our patients. And so when we can get engagement as a group, we will do the right thing for our patients. And I think we're starting to see that our employees are engaged around not only each other, but the organization as a whole, and working with their management team to achieve better results. So that's how I would connect that to engagement.
What's the top score on engagement? We're at 4.729. How high can you go?
5.0, so it's a 5-point scale. And certainly we would love to eventually one day get there. But as you go in, thank you for that. On page 5, you have our scores. And this year we hit a 4.29. That is exceptional. We are in the top quartile across the nation or within this database. Press Ganey, if you look in the appendix, there are a number of organizations, top performing organizations that we are compared to. They have over 1 million data points, and they serve, this is what they do. And so we are in a database where we're at the 84th percentile now, and that is extraordinary for us. We are only 6 points away, 6 percentile points away from being in the top decile. And so we have a lot to be proud of, because if you recall, we started at the 19th percentile. So great improvement over the last 4 years. And over 2015, we were at a 4.22. Our top key drivers here, it's important for our employees to have a sense of belonging. They have indicated that diversity and inclusiveness in the work environment is important, and they want to have the ability to go above and beyond. Key demographic areas for us are our licensed technical group and those who are 1 to 5 years. So we need to continue to hardwire in that grouping, and you'll see some data that supports that. High performing items on our survey, employees believe that we are going to use the survey to make improvements. And in past years, that has been a low item for us when we first started out. Employees treated with respect, that is a high performing item, as well as employees go above and beyond. That too was a low scoring item for JPS when we first began the survey process. We have no low performing items. On page 8, our engagement outcome metrics, we had over 5,000 team members to take the survey. Our response rate was exceptional at 91%. The national average, and Pia, correct me if I'm wrong, I believe it's 75% for the database is the norm, and we were at 91% participation. So we were really pleased about that.
Is this an online survey?
All online,
All online, and
all anonymous.
everybody gets an email that says click here?
And it comes directly
pretty
from
good.
Press Ganey.
91% is pretty good.
And we don't force employees to take it. There is not mandatory nature. We ask all the leaders to emphasize the value of taking it. And the comment that I've always made, even if the results are challenging, and you know this by your own families, if you have people in your family talking to you, you have hope of making things right. When people don't talk and they won't take the survey, it's hard to make change, it's hard to help. Even if people take this, if 91% of your employees take it and say, I'm really frustrated with JPS because you don't do the following things, they care enough to talk about it and get it fixed. But 91%, over 5,000 folks in a 6,500 person organization, we're real proud of how they did.
That's great. Good job.
So we moved from the 68th percentile in 2015 to the 84th percentile for 2016. The best illustration, my favorite slide, is slide 9. It shows how well we are doing. So the green line is JPS, And the orange color line is the healthcare database, the national healthcare average, press gaining. So if you look at 2013, we were right at the 19th percentile. We were really not happy with that score. We were at a 4.06. The rest of the nation was at a 4.24. And then there was a slide by the nation, the national healthcare average, to a 4.12, and we shot up to a 4.22 at the 67th percentile. It became apparent to us that we needed to figure out, was this real? So we wanted to hold steady, and we set our goal that we would just hold steady at 4.22. That was our target, and we hit that exactly. But we went up a percentile point, and so we were proud of that. We also were recognized by Press Gaining for our commitment to excellence and having such a large jump. The rest of the nation began to creep up in 2015 as well. But you can see there's been a downturn again in the national healthcare average, down to a 4.13, and we have continued to excel. So again, really proud of our results.
Again, why do you think the national average was going down?
You know, if it were 2008 or 10, I would say, you know, the uncertainty of what is going on with employers across the nation. You know, to me and Pia and a couple of other folks, it's hard work, but it's the most rewarding work because you can see when engagement is there, an organization can turn. I don't know if all HR departments or all organizations necessarily have that philosophy. You know, they may not have the right mix of leaders. They may not take the information seriously. There are a number of reasons that could be out there. It could be they are cutting jobs and people just feel uncertain. But we have really found a really good balance, and I think in working on a number of things the HR committee has worked on, whether it be comp, whether it be benefits, whatever those things are that we've discussed over the last 4.5 years, I think we all have worked together to move it.
Right,
And so senior leadership involvement has been big for us. You know, we did not score well in 2013, but we instituted rounding and, you know, all sorts of things to have a better connection with employees. So I think they know that we're gonna take their feedback, whether good or bad. We're gonna take the feedback and we're gonna do something about it.
I think the other thing, Dr. Weber, and that same discussion came from Ms. DeVos and Mr. Adams a second ago as to why nationally it declined. When we interview executives or non-executives in the organization, in an interview, the first question they usually ask us is, are y'all about to be bought out, or is there a merger coming? Because many of them come from other organizations who are merging and consolidating. So my hypothesis on this and why that drop is that took place over the last 3 years, but now people are taking surveys and they're part of new organizations and they're establishing new cultures and new directions, whereas we've been working on the same cultural change for the past 7 years. And now we're starting to see traction from it. Others now have to recreate that whole thing. And so that's my thought nationally why that's going down.
Plus, what they didn't say, and he didn't say, is the reason we're going up and they're going down is because they don't have Robert Early
That is right.
as their CEO.
That is true too. That plays a
You
big
won't get
part.
any argument from me.
And that plays a big role in it, and we have a comment section as well, and employees write in comments. And anytime you can say you've had lunch with your CEO, or your CEO came to orientation, or after my first year, my CEO had breakfast with all of us, those things are not normal. Those things, I think a lot of organizations strive to have CEO engagement, but they can't always do it. And he plays a big role in it.
The other thing about the CEOs, as a board member, I've never received
A pie,
I've had some chickens.
a
Try our
pancake
best.
breakfast.
Try our best. You may be in line, I don't know. Just
You may
depends.
not want a pie.
Plus, if you add in that, not just as Mr. Early sits there as the CEO, but he's done a great job of surrounding himself with other CEOs.
Definitely. They're
I hope-
great people.
I hope you heard me.
Yes.
I didn't say senior vice presidents, but when you have other CEOs sitting with you, that makes a difference. And so I think that has all added to how we've moved it.
And we thank you, Mr. Chairman, you're quite kind. And we also have the belief that if somebody on our executive team or in our organization sees an opportunity to go to another organization, we applaud that. But we always want those folks back. For example, if somebody were to say, I've got a great opportunity to go to New Jersey, then our hope is that one day we bring those people back to JPS. Nobody I'm not thinking anybody in mind, I'm just saying, those are the kind of people, hypothetically, if your senior vice president of HR said, I'm going to go to New Jersey, your first reaction is, how strange that
They
comment
would never
is.
leave.
Yeah.
They would never leave Texas.
And then secondly, how do we get you back? So over a period of time, once you find out what New Jersey's like, we welcome you back.
And I would welcome the opportunity to come back.
The facade was great.
Tell Governor Christie, we wish him the best.
What a way to tell the whole
Yeah.
HR committee that you're leaving.
Well, just hypothetically.
So, then there are our outcome metrics, and, you know, you can see on specific questions how we're doing. The 6 questions.
Very sad.
Yes, 6 questions listed here are the questions that form engagement. So I showed you that pie, but there are really 6 questions that give you that percentile score. These are the questions. It's not about pay and benefits. It's around, would you recommend JPS as a good place to work? Are you proud to work here? Would you stay at JPS if offered a similar job elsewhere? Overall, are you satisfied? Are you willing to stay here for another 3 years? And would you recommend JPS Health Network to family and friends who need care? Now, that is a question that you all have asked about in previous years. If you look to the far right, we have continued to improve on that score. We are 0.12 up from last year. We are only slightly behind the national healthcare average at a 0.04 away. So that's great improvement because we were not performing well on that question in previous years. These are the key drivers, and I foreshadowed gave you a little bit of information about the key drivers on the earlier slide. But a feeling of belonging, diversity, and inclusion are important. Wanting to go above and beyond, providing high health care, quality care and service, and liking the work that they do. And you can see several of those questions, 4 of those questions have an asterisk. Those were key drivers for us last year as well. Our high-performing items, employees believing that the information will be used to make improvements, treatment of respect, going above and beyond, which is a key driver, feeling like they belong, believing that senior management's actions support the mission and values. We value different backgrounds, and there's a balance between personal life and work. Our greatest improvements, greatest opportunities over 2015, we improved on some of those same questions, going above and beyond, using the survey, that we care about our clients or patients. We treat employees with respect, and a low-performing item last year was staffing, and a great improvement around staffing. That was our low-performing item last year. So Press Ganey has a model where they rank departments or units by tier. So if you're a tier 1 department, you are doing really good. You're very engaged work unit. Tier 2, you're doing okay. I would say they're good. And tier 3 are departments that really need some work, whether it's around feelings of the organization, how they get along as a team, and then thoughts about their manager. We are pleased to say that our tier 1 units over last year went up, and we have 62% of our work units are at a tier 1. Tier 2 is 29%, so we had a drop there. And our tier 3 departments are now in a single digit at 9%, so only 21 work units. And then there's action planning readiness. That's how well or how do employees feel about engaging with their manager to action plan for better results. And so there's high readiness, moderate readiness, and moderately low. You can see that JPS is at an 87 for readiness, and those are the questions that bring up your readiness score, help to determine that. And we have moderately high readiness across the organization. Our readiness distribution, well prepared for moving forward, is 57% high, 27% moderately high, not prepared is around 2%. And so those work units, those last 11 work units will have heavy HR involvement and executive involvement to move the results. Press Ganey provided us with a summary of recommendations, and so those are listed for us as well. Many of these recommendations were the same recommendations they gave us last year. We followed those recommendations. We put together an organizational action plan to achieve the 84th percentile. There are, again, 21 work units that need some assistance, 9 with a low action plan readiness score, and we are working on those with those units today. And there is some information in the appendix to help you kind of do a deeper dive into some of our demographic data. And so if you have any questions, we will be happy to discuss it with you and go further. But that ends this presentation.
Can I just tier 3 versus tier 1? What's a tier 1 in comparison to tier 3?
So the tier 1 is the unit that's doing really well. They're engaged. When you walk in the unit, you kind of know that they are.
What unit is considered a tier 1?
Units considered a tier 3?
So,
Just for compare, I'm just curious.
Well, let me-
administration.
Well, I'm lost too. I didn't know what the tiers meant.
Tier 1 is going to be your high-performing departments based on some of the questions they answered, based on a variety of other things that would make them, who stays, retention ratios, do they go to the functions, are they filling out their 90-day work plans, all those kind of things.
So
That's
which-
a high-performing.
Okay, which is a low performing? A named example of a unit that is considered tier 3.
I don't have my list here.
That's with me.
I don't have my list here,
One
but
could be our recruitment team was a tier 3
Okay.
in HR, but we have several departments within HR, not just human
So
resources.
there's a list that identifies these
Absolutely.
units.
Right.
So we
Yes.
know exactly who
based
they
on
are.
how they answered, and we have begun to take that, as you see by the stats, we're moving more out of tier 3 and up into tier 2 or tier 1. Tier 1's the best. We had a lot move from tier 2 to tier 1 this time. And it's basically how involved you are in the organization and what kind of answers you're providing for the overall survey. And all that goes into factor to determine that's a high-performing department.
Okay.
Okay.
Any other questions? That was good.
Yes,
Yeah,
right.
I had a couple, a comment and a question. Well, I thought, let me rephrase that. Maybe it's a statement. Press Ganey does well with these type of scores, because I remember Bill talking to us about we didn't like Press Ganey in some other areas when he would do the dashboard. So, but we're doing Press Ganey now, using Press Ganey.
Yes. So Press Ganey, we use what is national?
NRC.
Yeah.
NRC for patient satisfaction. And we use Press Ganey for employee engagement. Press Ganey purchased a company called Moorhead Associates back in 2013. And so when we did our RFP to determine who we would use, we went with Press Ganey because Moorhead was actually the company. And they had a very robust database. So when they merged with Press Ganey, it made them one of the premier for employee engagement.
We did not feel that Press Ganey was doing a good job. When Bill came and told you about a variety of things,
Right.
Press Ganey was not the organization it is today. So we left Press Ganey, and to Nikki's point, we signed a contract with Moorhead. We were a little bit surprised after a year of being with Moorhead. Moorhead said, we've now been bought by Press Ganey. But in that acquisition of Press Ganey buying new and different groups, they also changed their leadership. They changed their CEO. They changed their whole organization quite a bit. So Press Ganey is not the organization it used to be. It's also the largest of the organizations out there. I believe it's the largest for information like this. So the database by who we're compared to is far greater. But the group we worked with, Moorhead, is now part of Press Ganey, and it has helped them a lot.
The reason I asked you about engagement earlier is because really, and I know this is not his evaluation time, we've already done that, so he hasn't paid me off to say this, okay? But I think that for me, employees become engaged when leadership is engaged. And I think you can see that as an example, when the police officer left the hospital and the press is trying to interview our CEO, and he's in the crowd hugging employees. Will you get over here and do the interview? Okay. So, I mean, and so I think that had a lot to do with it. My other comment or question, we're at a good level.
Yes.
We're ranked high. One of the greatest chores is to stay there. But I do believe that once we improve where we are, we'll add the incentive to stay where we are. But I think that the challenge on here and staff is finding a new innovative way, those things, to keep us there, to keep us engaged, you know. So maybe Robert has to cook pancakes and carry them on the floor when he rounds.
Are there any other questions? Nikki, I would say that it's an excellent report. We are moving in the right direction. But I also think that one of the biggest improvement in the area is some of the programs that you've put in place, training those frontline leaders who are interacting with staff, that staff, when they get those surveys, that is showing that they are working together. And that makes a big difference for staff to stay. So thank you for the good job you've been doing, you and Pia.
Can I just make one other comment?
Yes.
It triggers them when you said that, because you know when you go to a company and you get good service, you're kind of excited about doing the survey. You know, and I think that's what you just said, Dorothy. That's a good example of that.
That's a good time to be able to do that. Other times, if you're unhappy, I do surveys when I'm unhappy. So you always get the bad stuff, but when it's going well, folks will take the time out to do it. Are there any other questions on the employee engagement survey results? All right. Nikki, I know I'm pushing. Nikki, I know we are pushed for time, and I know we don't have, on succession planning, is there just a couple of brief statements?
Just
Okay.
a few brief statements around that. Robert and I have worked with the Exeter Group to assist with the succession planning moving forward. And so we've had some preliminary meetings. They are collecting data.
Okay.
And so it is going to be something that will be reported out in 2017 calendar year. So just wanted the board to know that we are working on that. There will probably be a few interviews that will be necessary, but we have a plan, and the Exeter Group, Alex, is working directly with Mr. Early on that.
Very good. Thank you.
Yes, ma'am.
All right. Appreciate that. Are you doing the performance scorecard?
Yes, and this one
Okay.
will go fairly quickly as well. The incentive dashboard you have in front of you, it looks very similar to this document I'm holding up. And are we able to?
long sheet, the long one.
Yes, you may have a longer sheet, but we wanted to report out to you our performance, and we came before you back in September to let you know how we were performing as of, I believe it was August at the time. And so you can see, if you look to the far right, there are several check marks that indicate that we are on target or we have exceeded the target.
Okay.
There we go, thank you.
Okay.
There are several items that we have been working really hard on, especially around quality, not only employee engagement, but you can see great improvements in service as well as stewardship. Population health, we reported in September that we were not hitting that metric, improving days to third next available for primary care. And so that will continue to be a focus. You heard from Dr. Johnson, Diana Prachel, and Dow Tucker about physician recruitment at the last HR committee meeting and how that is playing a factor into that particular metric. And so we have the graphs to show our performance over this past year so you can see the empirical data. But we are really focused on these metrics as well as several others. I'm going to use this document, for our closed session item, but wanted you to have this information as well.
We will be covering that a little bit more in closed session, so what I'd like to do now is to reconvene for closed session now, okay? Ready? We will reconvene for open session. Is there being no further business, I'll entertain a motion for adjournment. Okay? All right, we're adjourned.
You got power right here. Tell us when you meet over there.
Oh. Wait a minute, I gotta go get me a makeup artist now that I'm looking at